We'll call it. County Commission meeting for July 12th, Wednesday, July 12th. I wonder if you will rise and join us in the.
Heavenly Father, I don't have to identify the names in here, Lord, you have that covered. You know what we ask for from you, Lord, is that we have peace and kindness in our hearts and love for one another, that all the individuals today do their due diligence and return safely to their families. In Jesus' name we pray. Amen.
Amen.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Oh, there's my God.
Reach just that feet.
Is there anyone signed up to speak publicly?
There's not.
Does anyone on Zoom wish to speak publicly? Anyone on Zoom wish to speak publicly? Wendy, I see you hiding back there. Is there anything you wanted to share, Wendy?
Oh, sorry. I thought you were gonna say it.
No.
No, I'm here to hear about the hospital project.
Oh, okay.
So, yes.
Ready?
Thank you.
You got it. Let's go to that consent agenda. What's the pleasure?
Motion approved, please.
Motion to approve the consent agenda. Any discussion? Hearing none, all in favor signify by saying aye. Aye. Any opposed? Hearing none, motion carried. Number 3, payroll change notices A through D.
Motion approved, A through D, please.
Motion to approve payroll changes A through D. Is there any discussion?
I'd like to. How many people resigned from 911 last year?
I can get those numbers for you. I know that the majority of the resignations have been individuals that have been trainees that have started and then maybe realized it's not for them or whatever it might be.
Do we need to evaluate our training program? It seems like there's always somebody on there from 911.
I don't think necessarily we need to evaluate our training program. I mean, 911 being a dispatcher is a very hard job and not everyone's cut out for it.
Do we have them do tests like we do with the deputies to make sure they're mentally capable of handling the job?
They do tests prior to an interview process. There's an assessment test that every applicant takes. And depends on their scores, they move forward to have an interview.
And they come in and sit with the dispatchers.
Correct, they do sometime in the room even before their interview, just to see how it is.
And the new hire part from the regular review board.
Help out with the summer parks program.
Anything else?
We're gonna have to replace the maintenance department resignation.
Maintenance department. Oh, Andrew, no, he was a part-time help. We might look to replace him, but for right now, we have not made that decision.
All questions I have.
Hearing none, all in favor, signify by saying aye. Aye. Any opposed? Hearing none, motion carried. Okay, I have 9:05. We have a set copy of a will in place of lost Reggie. Yes, please. It is September. Sorry. I don't know why I was thinking Stephanie. And then when I looked, I said, yeah, I know where it's at. September, you can just speak from back there if you want to.
Okay, I'm just needing you to accept a copy of a will because of a house fire.
And you're positive it was in the house. You looked everywhere high and low and haven't been able to find it.
And what is it?
Right. And it wouldn't be anywhere else.
No.
Okay, I better do this first. You swear to tell the truth, the whole truth, and nothing but the truth to help me God now that you've told us everything.
Yes.
As a lawyer, laughs and smiles. Okay. Motion to accept a copy of the will for probate.
Yeah.
Okay,
Motion accept copy of the will for probate, please.
okay, is there any discussion? Does anyone else have any questions?
Who's gonna prepare the order?
I think the system has an order.
Say it's right here.
Good.
I have it.
Okay, all in favor, signify by saying aye.
Aye.
Aye. Any opposed? Hearing none, motion carried. Once the order is prepared, then you can check with the clerk's office and take care of what you need to do.
Okay, thank you
Okay,
guys.
you're welcome. Good to see you.
You too.
Okay, number 4, we don't have any minutes. Number 5, requisition purchase orders invoices A and B. What's the pleasure?
Motion approved A and B, please.
Motion to approve number 5, A and B. Any discussion? Hearing none, all in favor signify by saying aye. Aye. Any opposed? Hearing none, motion carried. Number 6, exoneration corrected tickets, joint property applications, A and B, exoneration and corrected tickets. It's a pleasure.
Motion approved A and B, please.
Motion to approve A and B under 6. Is there any discussion?
Yes, ma'am, I'd like some explanation on some of the corrected tickets.
Rocky said he can't, he's not here, but if we want to call him, we can call him. With any questions.
Okay, would you like me to get him on speaker?
I meant to say that when the meeting started.
Susan, I could try to answer.
Oh, you can, okay, okay, that's
I will
fine.
do my best.
If we need him, then we'll call him. I guess.
Okay.
Okay. Just identify yourself for the record and
Deanna McNeemers, Jefferson County Assessor's Office.
Progress.
There was a linking issue with that. It didn't, we got a new system and it didn't link properly. So we had to fix the value on it.
Dire holding.
That one I'll have to look into. I'm not sure. I can see the ticket, the tickets.
Well, just so the public to understand, we're looking at 327,000. I think it's very large number.
this time of year is when you have these, right? Yeah,
Yes, we only can do them a certain time of year. This is for the new tax year, the 2023 tax year.
and a lot of this is on the taxpayer. The things they did or did not report.
Yes. That one there was erroneously, the Dyer Holdings was erroneously left at a class 2. And with it being an LLC, we have to change it to the higher tax class as class 3.
So that's more taxes. See, some of these are more and some less. It sometimes evens out.
Groundworks.
Numbers. 94, AP 94.
Yeah, 94.
That one there, I'll have to double check. That one there looks like it's just a name change correction because the value didn't change, the amount exonerated or corrected ticket didn't change the value. It looks like it should be in the name of JES Construction LLC, doing business as Basement Systems.
Yeah, because they sold out.
Third one LLC, RE 284. 48,000.
SBR one, we created new tickets for the 2020. So they would be assessed for the 2023 tax year that come in late. So we adjusted the value once we took it and created all of the other SBR ones. That represents the value from where it went from 64,800 to 49,000.
One was done some 5,300. Already 3,430.
Oh, you're good. The leasehold building was being assessed on personal property as a leasehold, and we removed it and added it to real. And that went from an amount exonerated of $1,400 to a corrected ticket of $5,300. It should have been on real for the 23 tax year.
Was all my questions.
Thank you. Appreciate it, Deanna.
Thank you.
Any further discussion on the motion? Hearing none, all in favor signify by saying aye. Aye. Any opposed? Hearing none, the motion is carried. 9:10, the state hearing allows Charlotte Henry to administer the estate of Ada B. Moses.
Charlotte Henry. Come on in. Go ahead.
Charlotte, you raise your right hand. Yes. Do you swear to tell the truth, the whole truth, and nothing but the truth about you God?
I do.
Okay, do you wanna? Yeah, what, do you wanna say anything about your petition? For your
No,
request?
Ada Moses, I had taken care of her for like 10 years. You know, and then she got really sick and she was living at my house for a while because her house burned down there in Salem. And I cared for her and got all of her groceries for her and made sure she had something to eat, and took her to the doctors. And when she got really bad and she was living in an apartment there in Salem and she got pretty bad and she knew she was going to pass away. So she ended up going to the hospital and she passed away on March 5th at 11:10.
It appears, I guess there were two individuals or two grandchildren. And from the file, it shows that Tanya signed. And this Dawn Henry,
That's my husband.
okay, he signed for the certified mail
Right.
for this hearing today.
Yes, that's my husband.
But Michael did not. And he lives in Georgia,
Yeah, they're both of them
and
grandchildren.
neither one, Tanya's not here.
I don't know him. So.
Okay. Anya Helms? Nobody else in the hallway, was it? Good.
No.
My only question is anybody after 30 days can qualify as administrator? Is there a reason that you want to try to qualify under this will?
for me to qualify under administrator.
Mhm.
Yeah, I would like to.
I mean,
qualify for
I
it.
don't see an issue with her wanting qualifying as the administrator, administrator of fate.
Yeah, yeah, I've never-
I'm not real sure about this will.
yeah,
So,
yeah. Yeah, I can qualify for the administration of the will.
because this doesn't, you still would have to post a bond because this will, there's
Yes.
nothing about not having
Yes,
to post a bond.
yes, I had already contacted
And if
somebody about.
You're
the will.
okay with the grandchildren and they don't have an issue,
No,
that's what I would suggest.
no, she hadn't really seen the grandchildren since they were little. She had broken
They would
away
probably
from
be
us.
sent waivers. So, yes. That's what I would suggest.
The motion to allow Charlotte Henry to be the administrator, but he didn't see Moses.
Well, she can do that on her own, really don't need to take any action. You're good to go. So you just need to go to the county clerk's office and explain to them that you can qualify as administrator and don't have to go through this process.
Yeah, I'd already spoke to somebody about lawn, so,
Okay,
okay.
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 Good, sure.
Yeah.
Okay, 9:15. We have an update from Mon Health.
Good morning.
Good morning.
Hopefully I'll be brief and prompt and answer questions. I do have a thumb drive with a presentation. I don't know if anyone knows how to put it in.
Is Donnie here?
Well.
Everyone's
they
looking
didn't teach
quizzically.
you that one, did they?
Did I scare you already?
She's an intern. Thanks.
Put you on the line.
Oh, there he is. He wasn't
No.
far.
Presentation.
Just a bit far.
Yeah, sure. Morning, I'm David Goldberg. I'm President and CEO of Mon Health System and Executive Vice President of the new Vandalia Health System that's about 1 year old. And more importantly, I'm the dad of two, wife of my college sweetheart. Those are the most important things. And Vice Chairman of the Fairmont State Board. I can't buy myself off of that. They're a great group. Dr. Davis, actually, for anyone who's interested, our new president, Dr. Davis, is having an open house today at Fairmont State at the Falcon Center, if anyone would like to meet him. Great guy, hitting the ground running. Thank you, I think that's perfect.
Oh, thank you.
Do I just hit the, on this?
Yep.
Thanks. So I wanted to take a few moments, if it's okay with the commission, to give an update on who are we since the last time I was here, status on our Mon Harrison Neighborhood Hospital. That'll be starting in the next few months to a year. And then healthcare in general, and then answer questions from the commission and anyone else if there is any. But what you'll see on the screen in front of me is what is Vandalia Health. On September the 1st, we announced the merger of Mon Health System and Charleston Area Medical Center Health System to create a new health system in the state. And what you see in front of us is our primary and secondary service area identified by our hospitals and the growth that we've had since we started. In the north, in the green, is the Mon Health System with 4 hospitals: Stonewall Jackson Memorial Hospital in Lewis County, Mon Health Medical Center in Monongalia County, Preston Memorial Hospital in Preston County, and our newest, the Mon Marion Neighborhood Hospital in Marion County. As you go with the other 3 H's a little further south that are aligned with us, we have a management agreement for Grafton City Hospital in Taylor County, Highland Clarksburg Hospital here in Harrison County, and we have a strategic affiliation with Mini Hamilton Health System in Calhoun-Gilmer area. To the south, and I'll get back to Davis in a moment, are the legacy Charleston Area Medical Center hospitals. Charleston Area Medical Center General, Memorial, Tays Valley in Putnam County, as well as Women's and Children's, also in Kanawha County. Earlier this year, we announced the acquisition of Greenbrier Valley Medical Center in Greenbrier County. That's in the south, as well as April 1st, we acquired Plateau Regional Medical Center in Oak Hill. So that made us, if you will, into a 10-hospital system. We announced a few months ago a management agreement and a letter of intent and certificate of need application submitted to the state for the Davis Health System in Elkins, Philippi with Broadus Hospital, as well as Webster and Webster Springs to join our system. They'll come in under the North. So we're excited about that. As well as we filed a letter of intent with the state to acquire controlling interest or 70% in Charleston Surgical Hospital in Charleston. So when you see 16 hospitals, it's owned and or managed under the Vandalia banner. So now we're more than 190 locations, and we're actually in 4 states. We're in Virginia with some clinics. You see up in the top in Southwest Pennsylvania, as well as Garrett County with some MON offices, as well as, so that's Pennsylvania, Maryland, West Virginia, and a little bit of Virginia. So we're bigger than I ever thought, and we're now more than 75 specialties across all of our sites across the great state of West Virginia. I always like to start with, what is the difference? So MON always leads with our mission of every patient, every time, and we lead with quality and service. And I joke, this is my TGI Fridays, for those who remember that restaurant, all the bling and the flair. All of the things that our people do so well and lead in the country. 3 of our hospitals in the North are all stroke-ready hospitals as accredited by the Joint Commission. You can see urological, gynecology, minimally invasive surgery, all centers of excellence, robotic surgery, as well as some urological procedures, gynecology, centers of excellence. We are the 24th comprehensive heart care center in the country by the American College of Cardiology. Only one in the state and the region to have that designation by the American College of Cardiology. We're the only AFib accredited hospital in the state and the region. Our emergency room at Monmouth Medical Center is what is called geriatric certified. Our auxiliary gave us $300,000 and we applied to focus in as a Medicare state. Most of the patients who use our hospitals are older, and we want to make sure that every program and service we provide is laser focused on the ones who use us the most. So you can see that's who we are, blue distinction from Highmark. We are accredited by the Commission on Cancer over at the medical center. And I'm pleased to announce we'll be expanding. We offer chemotherapy, cancer services at Monmouth Medical Center, Stonewall Jackson Memorial Hospital. And thanks to the generosity of the federal government and the advocacy of Senator Manchin, Senator Capito, and then Congressman McKinley, we received a grant to bring that service out to Preston Memorial so those poor patients don't have to drive all the way into Morgantown for chemotherapy. We could do it at home. We'll be opening that service this fall. I always say, you know, what's the difference? There it is. These are all the services, accolades, recognitions across all of our facilities. It's a long list. It's an eye chart. But again, we lead with patient experience and patient outcomes, and then everything else follows from it. We continue to be a 4-star CMS hospital at the medical center. We continue to be, Leapfrog continues to rank us as some of the highest hospitals in the state. That's a third-party reviewer of all of our publicly reported data and outcome. We dipped last quarter. I'm pleased. I just saw today, people will be pleased to hear our most recent ranking, as well as Stonewall Jackson Memorial Hospital in Lewis County was recognized as a top 100 safety net hospital as well. So really pleased to bring that to Harrison County as we move ahead to bring Mon Harrison Neighborhood Hospital later this year. This is our map and all of our services. And at the medical center, I always like to say, what don't we do rather than what we do? We don't do neurosurgery today, and we are not a burn center. We don't do heart transplant, but we do everything else in between. And when we can't do it, we partner with all the regional hospitals, whether in West Virginia or in Pittsburgh. And we have patients who elect to go to Johns Hopkins or Cleveland Clinic or other hospitals for more advanced care that we can't do close to home. What I think is exciting about North Central West Virginia, and you all live it like I do, is we have the best healthcare around. You don't have to travel far to be able to get the level of care you need and the experts you need close to home. But we also have affiliations, alignments all across the country for high level care if it's needed. Mon Health Preston Memorial has many similar services as a critical access hospital, but one of the claims to fame for that hospital is they are a bariatric center of excellence that you don't usually see in critical access hospitals. The other thing that's special about them, they were the first stroke-ready accredited hospital in the state as critical access. So we really are making sure we bring the programs that matter to the community, and you'll see that when we open up our facility here. Montville Stonewall Jackson Memorial, long history in Lewis County. We received a positive affirmation from the Healthcare Authority to move that facility from the side of Weston it is today to right off of exit 99 on land we own right frontage of Route 33. And we'll be breaking ground on that facility this year and hope to have it up within the next 2 years. It will be a brand new facility looking very much like our Preston Memorial Hospital. It offers surgical, OBGYN, emergency room services, everything that you'll see in a full service hospital, which it is. Mon Marion Neighborhood Hospital opened a year and a half ago. It is unbelievable to see how it has blossomed today. When we opened it up, December of 21, I think it was, here we are. We opened it up, we did our ribbon cutting. We literally opened it up 364 days from the day we cut the ribbon to the day Senator Manchin and Secretary Becerra were with us to cut the ribbon for that facility. Senator Capito came a couple weeks before it opened. We are seeing anywhere from 30 to 45 emergency room visits a day. Today, we have 7 patients of the 10 medical beds. All of our beds at that hospital are linked to what I call our monitor war room for cardiac telemonitoring. So we have rule out chest pain, rule out heart attacks there. What it doesn't do is it doesn't have OB delivery, and it doesn't have operating or cath labs. It is a medical hospital. It is amazing over the last year and a half how many people go thinking it's urgent care. It's not. It is an emergency room with medical beds, full service radiology. We started doing outpatient lab that people can go there, outpatient CAT scan, X-ray, ultrasound, echo, on top of the diagnostics that happen with a medical hospital. It also has a pharmacy. So we're able not to do outpatient dispensing, but inpatient medicines for patients in the beds that need it. And it's all controlled in what's called a pharmacy dispensing unit there. So we're real pleased. 24/7 coverage by an ER board certified ER physicians. And we have what are called hospitalists who take care of the patients that are in the medical bed, all board certified. And we also have infectious disease who goes down there, and we use telemedicine for other consults, cardiology and other surgical specialties or medical specialties that would be needed. And if they need higher level care, they would be transported either to UHC or into Morgantown for surgical cardiac catheterization. It's always patient choice trumps. Where a patient has the established relationship is where that patient will go. We are 164 beds at Montville Medical Center. We have the only regional long-term acute care hospital. We just expanded that by 9 beds. We are now a 34-bed hospital within a hospital. It is that entity. We own 20% as Mon. Select operates that hospital. It is a tax-generating hospital within our 4 walls. So it generates to the TIF district. It generates revenues to the county. We are the county hospital. And it also provides a level of service we don't have in North Central West Virginia, as well as all the other services I've mentioned there at our campus. Preston Memorial, you can see it there, 25-bed critical access hospital. And Stonewall Jackson Memorial is a 70-bed general medical and surgical acute care hospital in Lewis County that will be moving when we begin construction onto the land I just mentioned a couple minutes ago. And here is if any of you haven't seen it, this is our newest facility in Middletown Commons. It is the first constructed hospital in more than 21 years in the state of West Virginia. Most have been rehabbed or renovated. This was brand new construction right there in what was, I think it was an FBI office at one point. It was a mall, it was a church. I love that it was a church, so we have good will overseeing all of our patients as they come in and out of that facility. A lot of EMS traffic comes in and out, as well as people, what I call the walkie-talkie, or people who walk themselves in, drive themselves in. The first day we opened, we had somebody trying to steal from one of the local retailers, and they busted their car into concrete, and they were our 3rd patient. So they literally, we take all, and being very close to with Whitehall, with the sheriff, they round every day, multiple times a day. We have panic button and surveillance. Couldn't ask for a better relationship with law enforcement, and know we'll get the same when we open here in Harrison. This is a rendering. It might change a little bit. but it will be, and I gave you a brochure of what services are at Marion that you'll see as we open up at Mount Harrison. Full service hospital, 24/7 emergency room, CAT scan, ultrasound, echo, cardiograms, X-ray, medical beds, cardiac monitoring, everything that we are experiencing here in Marion will be at this hospital when we break ground. Very excited about it. It was a non-contested application to the Healthcare Authority for us to do that, which I think is a testament to the region. We thank the County Commission for your support of our application, as well as our elected officials. It is more and more important to be able to bring access closer to home and to be affordable. We did not expect Mon Marion to be revenue over expense as quick as it had, especially with the payer mix we see in the market, mostly Medicare, mostly Medicaid, mostly PEIA, which pay a little less than cost, but we are generating surplus, which is good, so we can reinvest into new programs, new opportunities. We have no agency staff in Mon Marion, and we expect no agency staff when we open up. We have 50 people or so on the payroll at Mon Marion. We expect the same at Mount Harrison. And we also are looking for, as the community needs more healthcare services, we will grow that campus to be able to provide more services as the community needs it. I am not a big believer in overbuilding and building too much too soon, but I want to be scalable and to be good steward of the resources as a community not-for-profit. Real quick, I wanted to talk a little bit about what we call Intermed Labs. Many of you know doctors come up with great ideas. They don't always have a way to develop them to improve the patient outcome. Dr. McClellan is a famed plastic surgeon, hand surgeon. He has multiple patents of his own of creating things, including the product called Cerucel out of Huntington, which is a topical ointment that helps make you younger, improve your skin. Ashok Agrawal has a consulting company, and Justin Chambers is a PhD. Tom called me on a Saturday about 3 years ago and said, there are many things we could do together to create better patient outcomes and commercialize products. On the right side, I joke all the time, my youngest daughter wants to be a theater director, and I got to Times Square before she did with a national award for a device called Fingy. And any of us who know people who have lost a finger or a digit know it's very hard to maintain your ability to be productive. Well, they came up with a device that you can laser scan your hand. We have laser printers in Iowa, I believe it is, that can produce a silicon digit, it's called Fingy, to give someone their finger back. And then we connected, after we refined it, an adaptation to it to connect to the thumb, so you can get mobility in your hand. We received a national award. The National Plastic Surgeons Society recognized it, 2 rounds, the American College of Surgeons, and Dr. McClellan has made it through 3 rounds of AGIL funding. Out of 1,500 applicants, he's made it to top 50. And that's happening right in Morgantown. We also, one of our doctors at Mon created a device to help with pain management during a particular urological procedure. No one in the world has done anything like it, and we sold our first device for millions of dollars right out of Mon. And our model is that our physicians should own the wherewithal from it. We own a piece. Mon is a 30% owner of Intermed Labs at Mon Health. So our doctor received the majority. We received a piece. It paid us back for our initial investment. We give them space on our campus. And that's happening here. And then we created a business called Snaps. Who here has had eye surgery where you have gauze and tape around your eye? Well, I think it's barbaric in 2023. So this group was able, with engineering students at WVU, created a silicone eye patch, if you will, that snaps on, snaps off. And we signed a deal with Premier, the large group purchasing organization, to distribute that device through 5,000 hospitals around the country. Vizient is interested, and that's being done right here out of North Central West Virginia, out of Little Mon Health Medical Center. So real excited about the things we're doing. And then all the advances, telemedicine in the top right corner, we opened up a cardiac clinic in Parkersburg. I was actually there last night. I was all over the state yesterday with our announcement of expanding Teays Valley. I was in Parkersburg. I was at Fairmont this morning and with you today. So my car is getting a lot more West Virginia miles than I ever expected. The middle is our minimally invasive gynecology certification. Aquablation, we are the only one offering that procedure in North Central West Virginia. It's power washing, urological. If you use high-speed water to help with TERPs, and we are leading the way. And that gentleman in the middle in the white jacket, Dr. Rad, did the first radical prostate removal in the state by robot in North Central West Virginia. And there's a new robot called the single port robot, and he just did it by going through the bladder to remove out. First and only kind in the state happening at Mount Health Medical Center. That patient left in a day and is fully productive. That's the kind of things that are happening in medicine today and happening right at Mon. As you can see, MRI scanning, the far left corner, thanks to the generosity of Ron and Stephanie Stovash, as well as the Hazel Ruby McQueen Trust and the health plan, we procured a mobile simulation vehicle and that goes around with the help and guidance of West Virginia Junior College to do clinical education at the hospitals. A lot of our rural hospitals don't have up-to-date technology to do simulation training. West Virginia Junior College has done that along with Fairmont State, Pierpont, and a host of schools, but we put it on wheels and we move it around the state. And then we also do reinforcement training at our hospitals with our own clinical staff. So you see Senator Capito, for example, toured us and was able to see that unit a couple weeks back. Some more internet labs I talked about. We do full service cancer treatment at the medical center. That's our linear accelerator that honestly the community bought. We raised $4 million from the community to have top in class technological advancement for cancer patients. And I'm blessed because my mother, I moved her here from New Jersey to be able to get cancer treatment, and she's living proof about our quality of care. Has nothing to do that her son is the CEO. It's all about the doctors. Some recruitment you can see growing in every area. People want to work at Mon. I joke the grass is greener at Mon. What's that?
My husband's neurologist.
Yep, Dr. Renzelli just joined with us. A neurology group out of Harrison County will be providing inpatient and outpatient services at Monmouth Medical Center. So we're excited about that. We have this group of GI group starting with us in October for full service, advanced and basic GI services. Bariatrics, as you can see, will expand with Dr. LaFontaine. We are bringing robotics out to Preston County with Dr. Hoppius, along with the 3 robots we already have at the medical center. And by the numbers, when I got here, we were $860 million in gross revenue. We're now 1.4 billion, more than 55 sites of care. Vandalia is the 2nd largest employer, non-governmental in the state. Mon is the 8th or 9th largest in the state on its own, with more than almost $250 million in payroll and taxes. And I always love to show the numbers. As I've shared with you, the pandemic was not kind to healthcare. We had losses last year. Through the end of May, our net operating income is a little over $14 million as a consolidated system. That's the 4 hospitals, our Village at Heritage Point, and our joint ventures. It doesn't include the Grafton, the Highland facilities. So very pleased with our performance, and we take that money and continue to invest in our people. We have not increased health benefit costs to the our employees until this past year on one plan. If they're on the high deductible plan, there were no increases to their health benefits. We gave raises every year, and we did not furlough or lay off one staff member during the pandemic. We used our treasury to keep people stable. And now we're continuing to grow the bottom line to be able to invest in projects like Mount Harrison, Mount Marion, and our other growth of recruitment of our staff. Here's our volumes through the end of May, and I can tell you June was a stellar financial month for us. Mount Marion had a stellar month. We are grossly, and I say that in a positive way, outpacing our budget in surgeries, visits to our clinics. ER visits are slightly down as we're getting back to the new normal. Candidly, I want more people in a primary care office than an emergency room. They get better, consistent care by a primary care doctor than going to the emergency room for chronic conditions. So that's purposeful. You don't hear a lot of hospitals talk about that. But that being said, we are steady at all of our hospitals and our ER back to pre-pandemic levels, which I think is leveling off the region. I am concerned of one area. Behavioral health is always an area of concern for me. And as we limit beds in the facility, the ER holds are going to go up. So we are partnering with Highland Hospital to see how we can be able to add capacity to that hospital over time. We will be opening up adolescent behavioral health services. We have 27 licensed beds there. We plan to open them up in September, October when we staff up. And once we get approval from the state and some waivers from CMS, then we'll be able to bill Medicaid and be able to take adult patients there as well because they have licensed capacity. Vicki Jones, the CEO, would have loved to be here. She has a cold and doesn't want to spread. If she was concerned it could be COVID, she doesn't want to give anybody COVID, but she's doing well. Here's our surgical, our office visits through May. You can see upward trend. And a little bit about Highland Clarksburg. You all know that it's a private mental health hospital that really deals with forensic patients. So they are court remanded for the most part into their facility, paid 99% of what they do gets paid directly from the state. You could have people there from 2 days to 20 years, criminally insane, and other types of status. We are licensed for youth services, other adult voluntary services. We just have to get a waiver from CMS to be able to bill for the adult services. The pediatric services, huge kudos to Department of Health and Human Resources. They gave us a grant in July to be able to help with funding to bring that staff on this fall. And Aetna Better Health gave us a grant also to be able to help get those services here in North Central West Virginia so our patients and hundreds of families don't have to leave the state for adolescent care. So we're excited to be able to bring that on. And if and when we need to, we'll be able to hopefully expand into adult behavioral health voluntary services once we get the approvals. So that's a little bit about where we're at. I'm excited. Our plans for Mon Harrison is to break ground later this year. Excited about the location, excited about the partnership, excited about the support we're getting from all areas of the community to come in to be able to enhance access in and around the community. So with that, love to answer any questions, provide any more insight if I didn't answer, or at least kind of give you a picture of how well Mon is doing. I love to get out more just to tell our story. The pandemic made it harder. And now I'm trying to get back out and tell our story that we're here to stay and we're growing leaps and bounds, but we're doing it. And I always say I like to be like Chick-fil-A. I don't want to do all things to all people. We want to be laser focused and excellent at the things we do very well, and then be able to drive that in every area of service and specialty. So with that, that's who I am. Any questions?
You said, well, enjoy. Thank you.
Thank you.
For a common sense guy, you get 24/7 care, stroke ready. I mean, working on 50 jobs. You're going to put $3 million a year in wages and minimum in our economy. It's amazing what you're doing for us.
And the things we buy from supply chain is all taxable. So every stent I buy, every medicine I buy, taxes comes back in on top of payroll tax. While we are a 501c3 and we are tax exempt as a hospital, everything else we buy has a halo effect on land values, jobs. I love that there's daycare down the road. I love that you have your emergency services down the road. I mean, it is right off the interstate, which makes great sense. I give kudos to UHC years ago for relocating there. It makes great sense for access, and I think we'll be able to do the same. We've seen it with Whitehall. We're going to see it with Stonewall Jackson Memorial Hospital and other facilities that we grow, like our outpatient center right there at the 79 Tech Park is booming. We hired more primary care, doctor, mid-level provider, cardiology is blossoming, Mountain State Orthopedics, hotels from us, and they actually see on I think there are 2 Mondays a month and they're seeing 20 patients half days alone just for orthopedics in that location. So the more we bring, it is the old adage of build it, they shall come. We are building it and they are coming. Thank you.
David, you guys hired a contractor yet?
No.
So did you hire somebody for the design?
We have designed with our management partner, Ameris, that designed the first building. We have brought in a land planner to look at the site and how we can look at the facility. So we've done preliminary work. Our certificate of need had the application about the dimensions and the services in there. The next phase now, candidly, I've been a little busy. I did not expect Davis Health System, one of our newest, to join our system as quick as they did, kind of put me a little bit off my calendar, to be candid. So now we are in the place of bringing in the planners to be able to do it. We've looked at the site. We have an agreement of a pad-ready site to be able to break ground when we're ready. The infrastructure is there. We have assurances from the developer. So we're real excited to be able to move forward.
How long can you hold your certificate of need before you have to start construction?
We put in and we said at the time that it would be, I think 24 months from approval. And we did go back to the state with an extension due to the pandemic and others. And we will continue to keep them informed as long as they're aware of what's going on. But if we don't break ground at a certain time, the healthcare authority could come back and say, if you don't start moving on it, then we have to talk about it. And that has not been the case in West Virginia, but I'm good to my word. When I say I'm going to do it, I'm going to do it
So you see breaking ground this year?
this year.
And it's located up beside Menards.
Yeah, there's Menards, there's some vacant land in between, and then we'll be on the far end. I call it where Mount Goldberg is right now, where some of the dirt is. That will be removed. Some of the infrastructure will be put in place so we can move it, whether that dirt moves to the other side or to other vacant property. We've talked with the developer and that will move forward when we're ready to break ground. The great thing about this model of hospital, it is very easy to replicate in the small format model. The rooms, the layout is very, very easy, if you could call construction easy. The difficult or factor or a little bit of a nuance this compared to Marion, as many of you know, we originally applied to go to Pleasant Valley. We moved that when I lost an arm wrestling with David Beafor that he thought the Middletown's Commons would be a better site. I feel reminiscent with Charles Point that where we were looking, got convinced there and the developers know better than us healthcare people. So we applied, we moved it, but we bought a box. So it was easier for us to be able to get open in 364 days because the box was already there, the infrastructure was there. We have to literally build out of the ground. So it gives a little bit more time. That's why the cost for this facility will be about 22.5 million, including the value of the land, versus Marion, that was a little bit under 15 million to build because it was already there. And we own that, by the way. Most sites like ours, they go in, they lease long-term. I believe I need to own my hospital. And we do. We own that and then have shared service agreements with Middletown Commons to do the snow removal and all of the kind of parking and such. That decreased the cost. Here, everything we're going to do, we're going to own and manage on our own property.
Okay, so your certificate needs based on a certain amount of time. You have a certain amount of time to get the building up.
No, it was contingent on in the agreement of when we would commence and break ground, and then you can go back to the authority and just either ask for an extension or explain why you're delayed. That's happened with other certificate needs around the state, whether it be procuring radiology equipment, whether it's opening up a clinic. And we're going to be doing that. And we've been keeping the healthcare authority educated on our status.
When do you think we'll sit down and become more involved in the pilot part of this project?
Over the next few months, we'll want to sit with economic development. We're going to want to sit with the county. Everything we do is going to work with the locality to make sure we meet zoning laws, everything from a construction perspective. Josh Clovis, who oversees our system construction, did that very well with Marion County and Whitehall and Fairmont. We'll do the same thing here with the municipalities, as well as the county and the state. We have to get life safety approvals. We have to get CMS. The good thing is this hospital falls under the license of Mon Marion, so I don't have to reapply for that. It took us 6 months to be able to get the ability to bill for service. I'm already contracted with all the payers, with Medicare. So day one, when we open, it falls in. We just have to get a life safety survey to make sure that we meet every requirement to operate safely, which we should do, and then be able to start operations the day after I cut the ribbon and we get whoever other dignitaries, including you three, and the mayors and others to be there.
Okay, because I mean, I guess my question is, it looks like since April, you all been working on a pilot agreement. And to this point, I don't know anybody on the commission that's been involved in this agreement or the school board or just exactly what everybody's agreeing to.
Well, I don't know at this point if there's anything for the governmental forces to agree to it or not. We got state approval when we go through the land, land phasing, approvals for development, everything we have to do at a local level, we will include. We'll definitely sit with the schools. I mean, we're going to be sitting with the Pierponts of the world, the Fairmont, about job creation. It's a site already where our medical students through the osteopathic school, through the nursing programs, rotate through these facilities. All of that is going to just become full-fledged as we open it, but then lay the groundwork as we move forward. Believe me, we're not going to open up the building until the municipality blesses it at the federal, state, and local levels.
You think you could get the county commission, the draft pilot agreement that was written on May the 2nd?
Draft pilot. I'll go back to council and see, as long as there's not an issue about sharing any of those, because it is a private deal between a private entity and our developer partner. But I'm glad if there aren't any special terms in there to be able to share anything that you all like to see.
Well, the quandary is it's being done by Steptoe and Johnson, who supposedly are attorneys. That's why I asked.
Okay.
We haven't seen anything, and I see where there's been a draft pilot agreement. So
Steptoe is our long-term law firm with Mon. They do a lot of our bond work. They've done a lot of our land work and others. So that's probably the relationship on our end. But I'll talk with Ed Phillips when he gets back from leave.
Okay.
Thank you, sir.
Thank
Any
you.
other questions?
It's very exciting.
Thank you. Look forward to being, and anytime you'd like me to come back to visit, I know I'll be going out to Bridgeport and Clarksburg to I see the mayor behind me. I want to keep them as educated. Is he still there? Oh, he left. He left. He snuck out when I started to speak. Figures. He's probably on his way back to Pete Dye. But we're going to be going out to keep everyone educated and get input on what we need to do. Part of what we do is called the Community Health Needs Assessment, which is a federal requirement. We do that each and every 3-year period. Not-for-profits need to submit that to maintain their tax exempt status. We will do one in Harrison County. Love to partner with the commission and your health department to make sure what you're identifying in your disparities, we represent in our building. We have a great working relationship with WVU Medicine. We did one in Monongalia County with them, with the health department. When the time comes, I'll sit down with Dr. Hess and ask him the same, is can we plan accordingly? As you have the Healthy Harrison establishment, we want to be a part of that and continue to be able to grow with you and make sure we cover the needs of the community. As you grow, we grow with you.
They're gonna make us grow, that's for sure.
You're growing on your own. I'm just trying to keep up with you. Thank you.
Appreciate it.
Thank you.
Thanks.
Sam,
Thank you.
sorry.
Sorry for being long-winded.
Thanks, guys. Appreciate it.
Need for next.
Good morning. Thank you for having me. Way back in May or June 2017.
You are.
Oh, excuse me, I'm sorry. I'm Sam Medea. Absolutely. Sam Medea with Schaefer Medea Law. And I was graciously selected to be the county's attorney in pursuit of the opioid litigation lawsuit that is now fully settled. Way back, May, June 2017, I came before the commission and spoke to the commission about the idea of filing a lawsuit on behalf of the county to pursue the opioid industry regarding this epidemic that has affected our country and certainly our city and this county. Thankfully, I'm very gracious that the county did select my firm to pursue that piece of litigation. Fast forward to July of 2023, here I am to report that there is an official settlement, a full settlement of all claims involving the litigation in West Virginia, involving the state, the cities, and the counties against the opioid industry and the defendants that we named in our lawsuit. That total settlement is for $960 million, and it settles all litigation in West Virginia regarding the opioid litigation. It's important for me to remind the commission about the context of this lawsuit, the procedure, where we started versus how we finished. The initial wave of these lawsuits brought by counties and cities across the country began in 2017, early 2017. The Harrison County Commission's lawsuit was filed in December of 2017. And when that lawsuit was filed, Harrison County, along with 7 other counties, were the first county cases in West Virginia to be filed at the state court level. Our lawsuit was filed in the Circuit Court of Marshall County, and it was one of 7 county cases at the time. Our goal, if you can recall, was to separate ourselves, our cases, from the national cases. When these cases started to be filed on a national basis, our federal court system created a multi-district litigation panel that oversaw and administered all these claims. We did not want to be a part of that. We wanted the litigation to be brought, litigated, heard, and decided in West Virginia. And we were successful in doing so. And following our lawsuit that was filed in December of 2017, other cities and counties followed our lead and also filed their cases in state court. Now, the opioid defendants, those that are opposition, tried to prevent us from staying in state court and tried to make us go to federal court. That attempt was denied, and thus our state court created a West Virginia litigation panel solely for the purpose of administering and hearing all these state, county, hospital cases. Hospitals were actually a part of the lawsuit at a subsequent time. All those cases in West Virginia were ultimately heard by the mass litigation panel. And it was made very clear by the judges overseeing that panel that they wanted all litigation brought together and resolved together. And thus, but for that mass litigation panel, if that had never been developed, as you recall, in November of 2019, I came before the commission, and there was a national proposed settlement that would have included West Virginia, the cities and counties. And that national settlement at the time in 2019 would have provided for $365,000 to be paid to Harrison County proper, the commission, as well as the various cities. So 365 total to be divided by Anmore, Bridgeport, Clarksburg, County Commission, Lost Creek, Lumberport, Nutterfort, Salem, Stonewood, and Shinston would have divided that 365. The commission, upon my recommendation, agreed to opt out of that national settlement, and that paid to be a good choice. Our other option is we, the commission, could have proceeded as Cabell County proceeded. And I'm not being critical of Cabell County. They chose to go a different direction, and they had their day in court. The Cabell County opioid litigation case had a trial. It went to trial. It was a 6-week bench trial. And in that trial, Cabell County, who had the same arguments, same claims against the same defendants as Harrison County Commission, lost. Unfortunately, they lost. That case was heard by federal court district judge, Judge Faber. He ruled in favor of the defendants, gave Cabell County Commission and the city of Huntington nothing, said that their claims under the law did not have merit. And thus, we opted out of the national settlement. We ultimately proceeded in state court litigation and achieved a total settlement of $960 million. The settlement is set forth in a very detailed West Virginia First Memorandum of Understanding. This is a public document. I will email it to Mr. Simmerman, and I will allow him to distribute it to the commission and to Laura. This is a very important document. This document sets forth the distribution. It also sets forth the approved purposes for which the money that ultimately will hit the county commission bank account can be spent. Okay, this is a very important document. The distribution is as follows. There will be an attorney fee and expense approval process. The judge will decide what that attorney fee is to be split amongst all the attorneys. that represented the various cities, counties, state agencies, so on and so forth. That will be decided by a judge. Case expenses in the tens of millions of dollars is how much money it took to prosecute these state cases. Those expenses will be brought before a judge, and a judge will decide what's appropriate, what's reimbursable, and what's not. The net sum is the money that's going to be paid to the cities, counties, the state, and the bulk of this money, 72.5%, will create the West Virginia First Nonprofit Foundation. It's 72.5% of the net money will fund this foundation. I expect it to be somewhere in the $500 million to $600 million range. 24.5% will be paid to the various cities and county commissions, excluding Cabell County, in our state. 3% goes to the state. So that is how the settlement was agreed to by all cities, all counties, state agencies, the state, is that distribution. 72.5% will fund this West Virginia First Foundation, nonprofit foundation. 24.5% goes to the various cities and counties, 3% to the state. Look, the background and the context was important to understand because the litigation ultimately boiled down to a nuisance claim. All our other legal theories of liability were either dismissed or abandoned, and we pursued the case on a nuisance basis. Had to. The damages available in a nuisance claim are limited. You get monetary damages to fix or abate the problem, the nuisance that you prosecuted. In this case, the nuisance was defined as the opioid epidemic, fueled by the defendants in varying degrees and varying capacities. That was the nuisance, the opioid epidemic. And thus, context of the lawsuit is important because, as I stated before, the settlement monies can only be used for an approved, and that's a defined term, an approved purpose.
Now, is that the 72.5% or is that the 24.5% or both?
All of it.
Okay,
All money paid to the West Virginia First Foundation has to be spent on an approved purpose. All money going to the
and that
cities.
would be approved by the foundation.
Correct.
I mean, okay, yeah.
Correct. That will have to be approved by the foundation, and there's bylaws and guidance. There will be a board of directors to oversee the foundation. There will be subcommittees of experts to provide input on expenditures and programs and so on and so forth. And again, for the commission to understand, when the money is ultimately paid to the county commission, in this instance, that money must be used and adhered to pursuant to the memorandum of understanding. As far as timing, when does this money come? It will be paid over a period of 7 years. And we expect the first payment to be paid to the various cities and counties either at the end of this year or the beginning part of 2024. And it will be paid over 7 years. We'll know more in probably 60 to 90 days once the court issues its rulings on attorney's fees and expenses and a little bit more. We'll have more answers about more precisely when that will be paid. So hopefully, for budgeting purposes, you guys have that well in advance. My best estimation at this time is that when you compare apples to apples, we passed on $365,000 coming to our county in 2019. We passed on that. My best estimation is based upon the fixed percentages of the money going to the various cities and counties. My best estimation is that Harrison County will be somewhere in the $4.5 to $5 million range. That's total money in for the county. with the commission receiving a little bit less than half of that sum, the remainder of the money to be paid to Anmore, Bridgeport, Clarksburg, Lost Creek, Lumberport, Nutter Fort, Salem, Stonewood, and Shinston. So, it would be my recommendation, and just that, a recommendation. This is a lot of money, just coming to Harrison County, okay? The big money, obviously, is to be paid to that foundation. And that foundation is divided into 6 regions in our state. The region of which Harrison County is in is the largest of those regions. Harrison County is the most central, geographically located county within Region 4. The foundation, as it has a requirement, has to spend money in that region for an approved purpose. And so it would be my recommendation, knowing that Harrison County, just on the 24.5% aspect, is going to receive a lot of money. It would make most sense, I believe, for the commission and our leadership to communicate with the leadership of Anmore, Bridgeport, Clarksburg, Lost Creek, Lumberport, Nutter Fort, Salem, Stonewood, Shinston. Might it be considered money economies of scale, how to best go together? That's up to leadership. It's only a recommendation from me. I also would recommend that law enforcement leadership be part of the discussions about what are some good uses of approved purposes. Prosecutor's office, medical professionals. We just heard from Mr. Goldenberg, or, people with expertise in substance abuse, opioid dependency, those sorts of issues, be part of that discussion about how this money is to be spent and used. One last comment before I answer any questions. You will see in the memorandum of understanding, I would take a little note here on page 1, 2, 3, 4. You receive this PDF. Take a peek at page 4. Paragraph 3. It will address jail fees, law enforcement expenditures, and how, if at all, that the money can be used to offset those things in terms of restitution going backwards. There's a provision in the settlement document for that. Questions?
If I may, I have one question.
Yes.
Would it be your recommendation when the time comes, the end of this year, beginning of next year, that we should set up a separate bank account for these funds so we can specifically keep track of them, like we're going with the ARPA, since they can only be used on certain things?
That's a good idea. Part of receiving the money, there's going to be oversight. There's going to be a lot of oversight. Accounting, auditing procedures, county commission, the cities, Lost Creek, for example, they're going to get some money directly. Whatever they spend that money on, they have to account for and make sure it's for an approved purpose. They will, they'll first have to submit that money to the regional committee on the foundation. And then the foundation then submits that for review. And if there's any expenditures that are not appropriate, I don't know the outcome, what will happen, but that's not a situation that any city or county wants to find itself in. So I think that's probably a great idea to have a separate fund where this money will go into and be used for an approved purpose.
Like our ARPA fund account, that way we can keep track of it and, yeah. Thank you.
Yes, the foundation will have an 11-person board,
Which meets tomorrow.
so Region 4, of which we're in, our region, yes, is meeting tomorrow. The Monongalia County Commission is the largest county within our region. They were tasked with organizing the nomination process.
They're also picking the boards there.
Tomorrow, correct.
Okay, they understand what.
Oh, yes,
They
yes.
see what happened there.
They are picking the representative, the
Yes.
one person representative to be the board
To
member.
be the liaison to talk to the 5-member governor's board.
Correct, yes, it's an 11-person board, 5 of which are appointed from the governor's office.
And Montague happened to have their own representative.
Correct. Yes, the largest county in each region organizes the nomination process. Yes,
Yeah.
and to be voted on by the various cities and counties within that region, who that one person board member would be. Yes. Yes. Now, within that,
We also speak about District 4. No.
yes, keep in mind, you know, my reading of the documents, my understanding of the foundation, there's various committees, expert committees that will have the recommendation and a seat at the table on how the foundation money, the big chunk of money, is to be utilized, spent within each region. So there's going to be some subcommittees that I see as being very important in terms of how the money is actually spent within each region. So, to your concern, if,
Not a concern, just a fact.
yes, if Harrison County does not have a board member seat on Region 4, there will be committee opportunities that I would encourage representatives of the cities and counties within Harrison County to be involved in that process.
And it all starts tomorrow.
The vote is tomorrow,
Somebody from each county there.
and city. And
Well-
city, yes, to vote.
They're start lobbying.
It's already started.
So what I would say is this, here in the next 60 to 90 days, we'll have a more clear picture on exactly net numbers and timeframes associated when this money would be paid out. Once we are there, I will gladly come back, give a further update. But in the meantime, I will send this memorandum of understanding to Mr. Simmerman. It would be a well use of time to become familiar with this document and to start the planning process with the other cities within our counties, how may be best to use the global sum of money that the county and the cities will see directly, separate and distinct from that foundation money. A lot of good could probably be utilized with those funds, especially if everybody's on the same page.
Well, thank you very much, Sam.
You're welcome.
Appreciate it.
We'll memorize page 4.
Great.
Paragraph 3.
Let me double check that. That's right. Yes.
Thank you. Have a great
Okay, thank you.
Thanks.
Okay. Elliot Marple. Accept grant check on behalf of Johnstown Community Building, Keith Marple.
Good to see you, Delegate Judge.
Huh?
Good to see you, Delegate Judge.
Same here. Get back to you much.
We have somebody from Johnstown.
No, they're all senior citizen meeting, all the ladies in the COES are, they're fixing the dinner for the senior citizens. And they couldn't be here.
You wanna have a photo of presenting the check, or are you good with just, I mean, I guess you dropped it off last week?
Yeah, we can have a photo op, but I'd have to get someone to away from the meeting for the next time or whenever you could.
Or we can take a picture and get it to you.
Huh?
Or we can take a picture and get it to you if you wanna do that. Or you wanna do a photo op with them? Okay,
Yeah.
okay, that'd be great. Okay, you wanna tell us about what this is gonna be used for?
Well, it's going to be to build a trench or a ditch around the entrance there where the water from the road is coming in the door. The building was built back in the 1870s, and the road is higher now than the building. And where the front door is, so runoff from any rains comes right up on the porch to where the door is, and a lot of times when there's a hard rain, it comes through the door and floods the inside, which is a wooden floor. And this will put a trench around it with gates, let the water in, and where the diversion ditch. And they can't lower the road and they can't raise the building.
They've done a good job taking care of that building, that's for sure.
Yeah,
It's good to have you at home today, at courthouse. Thank you.
thank you.
Good to see you.
So you want me to arrange somebody to come in the next meeting and do a photo op?
We can either do that or we can do it anytime in between. If you want to try to figure out, come in the next meeting, if they can.
Okay, I'll find somebody to represent, come in the next meeting. That'll be next Wednesday
At 11.
at 11. Okay, yeah, somebody will make it then.
Thank you.
All right, well,
Good to
thank
see
you.
Steve.
And I'm going to senior citizen meeting.
Is that what we said? Ed?
Thank you all.
Thank you. 9:35, funding request, Stonewood Volunteer Fire Department. I think I saw him a couple times. There he is.
Great. Randall Glasspool, President of Stonewood Fire Department. We're asking for help with our Fireman's Festival that we're doing in August. The reason why we're doing this is after the 75th Stonewood celebration was such a success, we had a lot of people ask us to continue it since we've lost the Blackberry Festival and to give something to bring more people into the area. So we said we'd give it a shot, and if it does well, then we'll continue this on every year. And we're asking for some help to put this on with some of our, so that way we can get like our advertisements or equipment that we need or whatever for the festival. And all funds from this will go to updating and maintaining equipment for the fire department.
Motion approved.
I think in
2,500.
2,500.
Motion approved, $2,500. Yeah, okay. It's a fire department.
Appreciate that.
Appreciate you.
Motion for $2,500 to be allocated to the Stonewood Fire Department for their, what do you call it?
Stonewood Fireman's Festival.
Festival. Is there any discussion?
Yes. I would like to make the change to that motion to 5,000.
How many days then does it mean?
Well, it's going to be a one-day event for the festival itself. And then on Sunday, it'll be on a Saturday, and then Sunday, we'll have a ceremony or a service from all of our area churches, and then the churches will put on a community dinner.
And what do we get for a 2-day event?
2,500.
Okay. I'll keep my motion on the floor, Madam President.
All in favor, signify by saying aye.
To mine or David's?
Up to yours.
Aye.
Aye. Any opposed?
No.
All right, thank you all.
Thank you. 9:40, funding request orders of the American Revolution, Daniel Davison chapter, Doris D. Sorry you had one.
I learned a lot while I was waiting. Good morning, I'm Doris Dean. I'm the recording secretary for the Daniel Davison chapter of the Daughters of the American Revolution, which was established here in Clarksburg in 1908. If you're familiar with the cemetery, you'll know that Daniel Davison, who had been given 400 acres here in Clarksburg, he donated the acreage to the Hopewell Baptist Church back in 1740-ish, to the Hopewell Baptist Church for a building and to the continuous cemetery that was already there. Through the years, we don't know who, what, or when had planted trees on what they believed was the property line. Those trees are now overhanging several private properties which face Dale Avenue, two in particular. We have talked with the owners of two of those properties who actually brought it to our attention because as the daughters, we go in to work on our pollinator garden and such. We only see it from the cemetery side. So viewing it from the homeowner side is quite a different story. There are numerous big and long branches hanging over the properties, which if a good windstorm were sustainable to come along, they stand a chance of having large destructive branches to fall on the properties, which would include the homes themselves. We filed a grant application with the county commission and asking for, the way I put it, was at least $1,000. We didn't know what private donations might be and other grant avenues that we might also follow. We have hired a tree trimming service, custom tree trimming out of Flemington, after having several tree services visit the cemetery, take a look at the problem. And then bids were accepted. Several tree services didn't respond whatsoever. And so we had our regular meeting last Saturday, July the 8th, and it was approved that we hire custom tree trimming service to do, pardon me, the trimming, cutting, and removal of the trees in question. There are approximately 12 trees, some of which are dead, that will need to be removed. The Mr. Soltis, who has the custom tree trimming service, had suggested, and we agreed and approved to have the work done in 2-day increments. That's the least amount of time that he can afford to relocate his equipment and his men and or women to the site to do the work. And that the daily rate is at $2,300, which for 2 days would be for $4,600. We currently have received in donations from within our membership approximately $1,500. And for the first phase of this work, a 2-day period, which we're going to be working on that schedule this week, we need $3,100 for phase 1. And I have communicated this information to both of the property owners. I do not know if they will be able to donate any funds. One said that they might, the other said absolutely not. But now we have the figures down pat, and so it's still an open book in their case. So the upshot is we need money for phase 1 of getting these trees out of the way of falling on homes on Dale Avenue.
Now, I hate to even ask this question, but have you asked from any, because this is located in Clarksburg, correct?
In Clarksburg.
From the city?
I have been in contact with the city. As a matter of fact, I'll be going over there this morning. I talked several times with the city clerk's office. They have offered one of their staff members to help me write a grant application. And so, yes, I'm going to do that. And by way of complete transparency, which I have pounded and pounded away with our membership, is that I've also applied for grant from the Antero Foundation. And to be quite honest, I went for broke and asked for $10,000. The full estimate that we received on the bid from the tree trimming service was just under $14,000. So we have a ways to go.
How do you, your funds, I mean, I looked through some of your financials. Where do those funds come from? I mean, you pay for.
The only
pay for
funds that we
dues or
have,
something?
yes, we just pay for our dues, our chapter dues and our state dues, and part of which then goes to our district, and then our national dues.
Where does the money for that come from?
That comes from the individual.
Okay.
Like I pay my dues every year. When I joined the DAR 4 or 5 years ago, I had the application fee, the national fee, and that sort of thing. You know, you have your fees all up front. And of course, the biggest portion goes to National for their programs.
So you don't have any actual.
We don't
funds or
have-
checking account or
We don't
anything
have
like that?
disposable income, no.
Okay.
And we are a 501c3 organization. And we have all the certification, which I believe I probably attached to the grant application. Maybe, I don't know, can't remember.
I'll make the motion and go ahead and give you the $1,000.
Would you consider upping that to 3,100 that we need for phase one?
We'll consider it if we talk to the other municipality.
Okay.
Is there-
Maybe
Yes,
Ann Terrell will
absolutely,
come through.
absolutely. You're right, Patsy. Yeah.
Okay, motion's been made for $1,000. Is there any further discussion?
Are these trees on your property?
I need to remeasure. I have the survey the last survey that was done was by MSES Architecture back in 1997. And it's possible that a couple of the trees may not be on our property. But we, the executive committee of our chapter decided to move forward with having the service done rather than involving another survey, possibly lawyers for each one of the property owners involved. And then if they involve lawyers, then we would
Is
have to
there a
involve lawyers
fence over
too.
there? Is there no fence over there?
There's no fence. I don't know how long it's been. Now, according to the survey that I have here, if you would like to see it.
We're their neighbor.
Yeah.
Yeah, you guys are up against the sheriff's office.
Yes, yes.
Yeah, on down one side and
Mhm,
down.
yeah, and the sheriff's office put that nice.
Stakes. Survey stakes visible out there.
Have not been able to find them because, as I say, this was done in, well, actually 1994, and it indicates where the stakes are, but I've not found them.
Yeah, I know you're talking about cutting whole trees down or just trimming the branch.
Whole trees. I did discuss the possibility of simply cutting them back with the two services, the two companies that came to the cemetery and walked through the whole process with me from both sides, from the Dale Avenue side and the cemetery side. And they said it would pretty well be fruitless just to trim them back for them to grow again. And as I said, there are some dead trees in there. They completely have to be removed.
I see where Commissioner Hinkle's coming from. I don't know that we need to be paying to have trees that may not be yours cut down. We can end up in court.
Could be ours.
They're not ours if they're facing Dale Avenue.
Well, actually, when I did my initial measurements, it was based on the 1911 survey. Because no other survey with the resources here in the courthouse, no other survey could be located. However, I did and subsequently received from one of our members the survey itself from MSES that was taken in 1994. These measurements are different. So that being the case, the survey from 1911 that I used was shorter. This is longer. So there's more of a distinct possibility that those trees are on, and it's
But
not a
that's the
straight line. Yeah.
possibility.
Yes,
where
possibility.
We don't want the county to get in. I mean, we want to help you.
Yes,
But we have to protect ourselves too.
absolutely.
I don't mean to speak out. of
Yeah,
turn.
no, I mean, that's, I know there's some trees that were along there and there was. First moved over there and I just told them, I said, we need to be very careful about who knows what.
Well, and that raises another question. While the DAR has been the trustee of the cemetery since 1911 and off and on has put it over to the American Legion, another time to city leaders, but it still came back to the DAR. We don't know who actually owns that property because no, the only deed I can find through the court system was where Daniel Davison deeded that portion of his acreage to the Hopewell Baptist Church, which has been defunct for centuries.
We want to be the ones to straighten this all out. I think it's something we have to get Charlotte. Research it, survey it,
Yeah. I mean, I
Even
don't
though
know.
we're gonna get some money there,
Take a
but
look at it.
and then figure out if we own property against this, it's probably gonna cost us more than $1,000.
Why don't we just give you the $1,000, we go ahead and do our due diligence and make sure yours is what's yours and ours is what's ours and everything's with everybody. And we'll pay for that.
We gotta
and we'll
make
pay for
sure
that.
what's theirs is theirs and what they
Thank
cut
you.
down is not
Is that
ours.
fair?
Or
Yes, I
somebody
think that's
else's,
great.
and
We'll
it
pay for
does
the
damage
survey.
when
So
you tear
Thank
it
that's
down.
you.
what Commissioner Hinkle said. We'll pay for the
Yes.
survey, but we're gonna help you.
We prefer you not do anything while the survey.
Yeah.
And the title search is done.
So we'll-
Contract.
So we'll make the motion that we'll give you $1,000 upon title search, Commissioner Hinkle, and survey, Commissioner Hinkle. And we want to be a partner with you, but we also want to get it right.
Okay, can we have that in mind with the expediency that's needed before winter sets in?
Do that.
Because that is what we had told our the tree trimming service, that our plan is to have this project done before winter sets in, because we're afraid of big branches falling. And I think time is of the essence. It's unfortunate that this problem wasn't taken care of decades ago, but it was not. So here we are today.
Susan, does your plat show like it does?
No,
here
it
on the
doesn't
map?
show their.
No, on your
This is
system, it is different. And I was told by some property folks downstairs that what's online is not usually what is on an actual survey.
When did we acquire the neighboring parcel?
3 years ago.
Okay,
Charlotte recommended that you take a metal detector
Mhm.
to find the property stakes.
And where might one get a metal detector?
Yeah.
I'm just kidding.
As I said, we have no disposable.
I mean,
income.
I think there's a way that we can try to figure it out without having.
But it's pretty easy if you hire somebody, just tell them you're trying to do these points that they've got the equipment to go through and find if their stake is there.
Yeah.
Cause
Yeah, a
I'm
lot of
looking
these-
at the plat online, and it's not making any sense.
No,
Well, you
yeah,
can't go by that.
yeah, I looked at
That's a
that
tax-
first.
That's a tax, yeah, there's a line that goes across there
Yeah,
on the plat, yeah. You can't go by tax maps.
yeah.
Us, I guess, do some homework
Well, we're your neighbors, so
and
we're
we'll
gonna try to. be
make
good
sure we
neighbors.
have your information and we'll be in touch. How's that sound?
Excellent.
And you want to withdraw your motion?
Yeah.
I mean, we're here to help you,
Yes.
but we have to protect ourselves and everybody around us.
Yeah, so to kind of be clear, do you want me to look at title on both properties, kind of cursory abstracted? And then do you want us to hire a surveyor and have our lot surveyed? Or you want to try to find the stakes
I think we
first?
should do at least.
I'd say we try to find the stakes.
Yeah, I mean,
Yes.
Patsy's leaning on one of the two companies to, or three, to not do it for all.
Given that, leaving no page unturned, since I had contacted the tree trimming service, which we agreed to hire at the DAR, and told them that we would talk about a schedule. I know you can't know how long this might take to do all the things that you need to do, but I also know that his schedule is already booked up for several months. And given the fact that we would strive to have this project done by winter, before any of the big winds come in, would it be fair to say that I could schedule with him in, say, 2 months' time to get on his schedule? Okay.
Won't happen.
I mean, I don't think it'll take that long to figure out where we're at, where you are, or where we are.
Yeah.
But I don't wanna commit to anything.
Okay, then I'll just confer
I
with,
mean, I don't know about these two.
yeah,
I'm just speaking for
I'll
myself. I just
confer
wanna
with the
be-
DAR executive committee and say, do we want to just go ahead and put on a maybe? So that he can work his schedule around, and then if weeks out, the information that we need isn't with us yet, we can always reschedule.
I'd say schedule, give us something so that, again, I think that, between the three of us up here,
I mean, we're here to help you. We just want.
Yes. Okay,
we used to have a surveyor that used to say, just haven't elected one in a long time.
Still could have it, but nobody files.
County's supposed to have
When I first came in, we had one office and then nobody, after he was done, nobody wants to do it.
Okay, well, if there are no further questions, I'm done.
But you understand what we're.
Oh, absolutely. And I completely understand that. Yes, yes, because we've been working on this since the first part of April. So this is just part of the process.
Thank you.
Yes.
Yours, just write down your contact information.
I have
Oh,
it.
she needs that. Yes, yes. All right. Thank you very much for your time.
You're welcome. Thank you.
Look forward to seeing you again.
Okay. 9:45 funding request, Clarksburg Harrison Regional Housing Authority, Rhonda Lindsay will be attending by Zoom, and I think I see her right there.
Hi,
Hi.
I just want to thank you guys for considering this funding request again this year. You guys have supported us year after year with this back to school event. It's scheduled right now for August the 16th. And we'll be, of course, sending out invitations to you all, but it's a big deal for the residents in the community of Laurel Lanes. We do backpacks. We do, they're completely full of supplies. There's games, there's inflatables, there's food. This past year, we added a resource fair where we brought in different resources from the community so that the families would have access to those. So Donna does a great job with this event every year. It seems to get better every year, with the exception of the COVID years, which doesn't really count. But we appreciate your support, and we hope you'll consider granting us the funding again this year.
Motion approved, please.
Motion to approve the
$1,000 requested.
$1,000 as requested, correct?
Yes, please.
Okay, is there any discussion or questions? Hearing none, all in favor signify by saying aye. Aye. Any opposed? Hearing none, motion carried.
Good talking to you, Rhonda.
Thanks, Rhonda.
Thank you
Sorry
guys so much. Thank you.
Okay, I believe we are on number 7, consideration of approval of a project fund requisition for the payment of costs associated with the project to be financed from proceeds of the Series 2019 bonds issued for Charles Point Economic Opportunity Development District Series 2021 A and B Development District number 3, White Oaks number 2, and Series 2008A Charles Point Project number 2, Northland Bay Improvements, A through D.
Motion approved A through D, please.
Motion to approve number 7, A through D. Any discussion?
Yes, ma'am. I would like to break A out as a separate approval. Due to the 2 different companies.
We need 2 different companies.
One's for,
They're all different.
which one's being requested from, ITech, is not.
ITech.
ITech corridor. It's 7A.
7A, the $297,926.58 that they are requesting. The vendor is, the first one is the Thrasher Group, which is $34,058.90. And the other one is Doss Enterprises, which is $263,867.68.
So I'd like to make a motion to approve 7A.
Okay, motion's been made to approve 7A. Any discussion? Hearing none, all in favor signify by saying aye. Aye. Any opposed? Hearing none, motion carried. You want to make the motion, so your motion would be to approve 7B through D, correct? Okay. Motion to approve 7B through D. All in favor signify by saying aye.
Have further discussion there, please.
Okay,
I don't think these bills, cover a lot of areas. And I think they cover a lot of areas that concern me as a commissioner that we were not part of, all the way from the pilot agreement between Mon General and the developer. we're all part of that. And if anybody in the commission was part of that, I appreciate they put their hand up. Or if our attorney was involved. We haven't been part of any of the drafts for what the final legal is gonna be. There's been constant conferences, discussions, and I'm trying to figure out who authorized this kind of expenditure on the part of the bonding. I don't see anything that says bonding company has agreed to this. I know that we're gonna send this to the bonding company, but I'm gonna ask legal if there's any way that this is gonna end up back on our lap, because I can't figure out who authorized all these telephone conferences with Genesis Partners and Unicap. And where the total of, what is it, a couple $100,000? So I just want to make sure that if we agree to send this on the bonding company, that there's no blowback on the commission, that we've approved something that should not have gone through, and that we have paperwork to cover that this was agreed to. So, Trey, I'll ask you if you're comfortable with recommending, then you think we covered ourselves. If we have calls here between Genesis Partners, Mike Romana, to discuss status of bond. Review bill which would permit the extension of life of certain property tax and analyze the same. Participate in CD board meetings, review the documents. I'm just trying to make sure that we're gonna sit here and say these are all good things, and that somebody's blessed this.
So when you say back in our lap, you're asking if the bondholders might reject the approval?
Yes.
Of the
And so
payments.
who's gonna get stuck with the payment?
So we kind of had a prior conversation about this, and I mean, the invoices reflect that I certainly haven't been involved, and that Steptoe and Johnson has been the lead on this really since day one, when the district started on behalf of the county in a number of different areas. I think your comments about getting copies of the pilot agreements and those types of things are certainly fair. The county should have those in hand as we sit here as a stakeholder and look at it. I can't sit here and tell you that I've reviewed every time detail entry, but Mr. Amon was very comfortable. And I believe it was 1 or 2 meetings ago that he is representing the county in his capacity in really what I would describe as a dual capacity on behalf of the county. And we kind of discussed that at length. And so to the extent Mr. Amon is comfortable with submitting these charges, I think they're appropriate. I mean, there have been instances where I wish that you all would be apprised of things sooner, because we get to the point where we're always kind of the last person at the table often who gets information, right? Particularly on development issues, but in terms of rejecting the charges, I can't sit here and do that.
I have the utmost confidence in Mr. Raymond when it comes to this. Okay, motion was made to approve B, C, and D. Any further discussion? Hearing none, all in favor signify by saying aye. Aye. Any opposed?
No.
Number 8, review, discuss, consider GSA update potential executive session pursuant to 6(9)(a)(4)(b)(9) to consider matters involving or affecting the purchase, sale, or lease of property, advanced construction planning, the investment of public funds, or other matters involving commercial competition, which if made public might adversely affect the financial or other interests of the county. Is there any need for us to discuss anything on this matter?
I have one thing, and it does not require executive session or anything. I was just notified that they did testing this morning of the generator. And it is functioning properly.
For now, as it has in the past, right?
So yes,
I'm sorry, I couldn't. Okay, let's hope it's still doing the same thing tomorrow or next week.
yes.
What's the status of the rest of the building?
For the punch list,
Mhm.
punch list, we're still going through, we went through the list the other day, just there are certain things that we need to go over and check on. We have not gotten time yet this week to do so, but we will.
So then a committee set up to oversee moving.
We have not set up a committee to oversee moving yet. At this point. We can sort of create one if you would like.
We have a work session for the commission to
I think
discuss
Laura
moving.
can handle taking care of that. She's already contacted movers and I don't know that we need a work session just to figure out what we're moving over there, when we're moving or what we're doing at this point in time.
When we need to do that.
I believe Laura is capable of doing that. And there are people that she can get to help do that. But if you want to be involved in it,
We just like to set some dates.
we can discuss it in a meeting. We don't have to have a work session.
I'm sorry, what did you say, David?
Moving dates.
As I sit here today, I would say that we are not ready to put a date on this yet. There's a few things that we need to finalize and make sure is done before we can realistically put a date on this, and that's my view.
But the elected officials signed off on each of their areas.
No, they have not yet.
We're probably not even there yet, are we?
No, there's still things that have to be repaired in their area.
Have they been through to see what they need repaired, or if there's some changes that they need to make?
I believe all the electeds have been over there, and if there has been a problem, like I know the county clerk wanted to change something, we worked through it. He was able to change it. I know Rocky's been over there, the sheriff's been over there, they've given us feedback. And
You might follow up with them just to make sure they're ready to rock and roll.
I will for sure. And also tell them about things that we're keeping an eye on in their department, just like a swinging door or something. To make sure that they know that we're working on that.
Oh, I.
Okay, anything else? Number 9, consideration of approval of project fund requisitions for the payment of costs associated with the general service of administration building project to be financed from proceeds of the series 2020 bonds issued for the Harrison County Building Commission, A through C.
Move to table.
Motion for table number 9, A through C. Any discussion? Why do we want to table it? Or why do you want to table it? What's the reason?
You want to talk about it in public, or do you want to go into executive session?
Well, I'm understanding that they need to be paid. That's what I heard.
Yes, they have already completed this work. One of the invoices is from October of last year. The other one is from September of last year. All 3 of these invoices are work that has been done by Ceiling. And we should pay these invoices.
Motion's been made to table. All in favor, signify by saying aye. Those opposed?
No. Motion approved A through C, please.
Motion to approve 9, A through C. Any discussion?
Yes, ma'am. Could staff tell us how much we're going to be asking of money for some back from ceiling from our last 2 meetings?
We don't have a number on that.
But it exceeds this number here in this box. Or close to it.
Fred, can we talk about this?
I had
And
to
the
go into
status.
executive
No,
session.
you didn't ask to go into executive session.
I said we
You're the
talked
one
about
that's
it.
supposed to be meeting with attorneys and know what's going on here. I mean, This is silly, I mean.
And I'm,
Is there not money left to pay this? I'll just throw it out there. There's money left to pay it, so. Okay, any further discussion? Hearing none, all in favor signify by saying aye. Aye. Any opposed?
no,
Number 10, review, discuss, consider appointing George Finley to the Mountain Rail Trail Board.
We should approve.
Motion to approve. Any discussion? Hearing none, all in favor signify by saying aye. Aye. Any opposed? Hearing none, the
No.
motion, okay, that was an opposition to appointing George.
yes,
Okay. Number 11, review, discuss, consider authorizing a voting representative to attend the West Virginia First Foundation Regional Director Selection Meeting at Milan Park, and it's for tomorrow
At 10 a.m.
at 10 a.m. Either one of you want to,
No, I do not have that's it.
Mr. Hinkle,
what time tomorrow?
10 o'clock.
Sure.
Mr. Hinkle will take care of being there tomorrow at 10 o'clock. We need a motion for that.
No. We do not.
Move on to number 12, review, discuss, consider voluntary consent and authorization to take the necessary action and steps to remove and demolish the structures located at Exhibit A, 50 Copeland Avenue, and Exhibit B, 122 Copeland Avenue.
Motion approved, A to B, please.
Can you somebody give me a little background on this? I mean,
Which one?
so they're willing to let us demolish it, is that what? this
Yes,
is?
they have signed right of entry. They're like, they're gonna,
At our cost.
we're gonna put a lien on the property.
Okay, that's what I, they don't want. Okay. Okay. Motion to approve number 12. Any further discussion or questions? Hearing none, all in favor signify by saying aye. Aye. Any opposed?
No,
Okay. Motion carried. Number 3, review, discuss, consider declaring properties located at 28 Main Street Enterprise. Lisa Kearns, number 211 East Oak Street, Hepzibah. Sheila Gorby, 229 Tiffany Terrace, Clarksburg, Charles, Dana and James Kreitz. And number 4, 1000 West Main Street, Salem, Jerry Murphy Jr. and Catherine Swiger as emergency nuisances within the framework of the IPMC. So the emergency measures abatement can be commenced.
Motion approved, A. Great job, Trevor. And your team.
I'd like to add that this does not burn with any funds for this demolition.
Motion to approve is how are we paying for this?
I don't know, man, what,
I'm asking Charlotte.
I have a total of 11 houses to be taken down. After that, the rest of the houses that need to be taken down, I am waiting for DEP to see if we get any money from DEP. But these 11 are emergency ones. They are very bad. Majority of them are burnt.
Do we have money to tear these down?
$750,000.
Commissioner,
same 150 last.
Again, I'm asking Charlotte.
it's the 150, yes,
So that you have enough money to.
yes.
Sorry, guys.
I'm sorry,
I just wanted to. Okay.
I'm talking out of turn.
So at the last meeting, we talked about this concept with the last resort.
Because
And
I
these-
remember you
And these
saying.
are horrible properties, they qualify. But my question is, how are we gonna bid them out? Are we gonna bid them out collectively?
Yes. Not
Collectively.
individually.
Okay, and are we preparing a bid to do that?
Yes,
Okay, that's gonna come back before the commission.
Right,
yes.
Okay, I got you. We're good.
Because I do remember you.
because the bulk is key.
So the
Yes.
motion's just to
So label
Right.
label them, but not
Bid that.
tear them down yet.
them and
Right.
bid out the work. Get some,
Okay.
get some
I'm
quotes.
fine with that.
Okay,
And majority of the tests that we are doing, the asbestos tests, majority of them will be back by Wednesday, next Wednesday. And we'll know more what we're looking at as to approximate costs.
So the motion is to move forward to come back to the commission with a cost estimate.
Yes.
of tearing these down
For all the emergency
for all the
problems.
emergency problems.
Yes.
That's your motion. Okay, any further questions? Or discussion? Hearing none, all in favor, signify by saying aye. Aye. Any opposed? Okay, hearing none, motion carried. Number 21, administrators report.
So the only thing I have this morning is what I feel is really big news and I'm pretty excited about. CSX has officially signed and executed the purchase sale agreement between us and CSX Transportation, dated July 10th. So it was just signed. According to the purchase sale agreement, our due diligence expiration will be on Saturday, January 6th of 2024. And we're looking, closing schedule is 30 days after Monday, February 5th, 2024. So at least we're heading in the right direction with the CSX properties and we're finally seeing movement. I know we're working on the surveys and everything else, so I feel that's pretty exciting.
Thank you.
Anything else?
No, man, that's all.
I don't have anything that.
Okay, Commissioner Hinkle?
Well, if you can go ahead, I gotta read a couple of things here before talk.
I'll get your. I have not. He's got to read something else. So it's pretty good.
All three commissioners have been contacted by the city of Bridgeport to attend a work session to discuss the Charles Point TIF. And they would like for us to set a work session up so that way all three of us can attend as a work session on the 24th at 6 o'clock. And I would like for the commission to host a work session for the 24th.
I've already discussed that with Ms. Pease.
So is a work session being held on the 24th?
She was going to reach out to the two of you to make sure that, so none of us talk together, to make sure that was okay. And then she can reach out to Mayor Lang and we will send out a note. If somebody will do the proper notice, if that's what you two want to do. So that's where I'm at with that.
I have not had the opportunity to talk to either Commissioner Treehouse or Commissioner.
Because we just talked about this chapter.
Correct. But I would get with both of you and we'll work on.
I'm fine with it. So I will be there, whether it's a work session or not work session.
And just to clarify, the work session, if we hold it, it will be at the city of Bridgeport.
Yes, ma'am.
Okay, anything else?
No, ma'am.
Motion to adjourn. All in favor, signify by saying aye. Aye. Any opposed? Motion carries.